4 years, 4 months, and 29 days I've been off fizzy drinks, and for about 3 years now I've been consistent with my workouts, and trust me, my life and periods have never been the same. Yesterday we celebrated Menstrual Hygiene Day and International Women's Health Day, and while I love being a woman, trust me, there are some days I'd rather take a day off or two, and that is when I am on my period. Welcome to Triple F, where flood is the new sexy. I am your host, Dr. Obels, and please remember to subscribe. This episode is rated 18. Viewers' discretion is highly advised. Have you had days when you roll from one side of the bed to another, groaning in pain like you're in labor, only for your family and friends to find out that you were just on your period? Yeah, I use the word just because it is seen to be normal and ordinary because we get to see it every month for at least 30 to 40 years. So we should be used to it, yeah? Well, no. No one gets used to a period pain because it feels like it metamorphoses every month, hitting a different pain, never ending all year round. This used to be my story over 4 years ago, but not anymore. While my period pain is significantly bearable due to my lifestyle changes, which I will share with you in a bit, I've gotten to admit some patients in the hospital for over 24 hours as a result of period pain. It can get as bad as being associated with vomiting, nausea, bloating, migraines, and dizziness. So much for being a woman. We refer to this pain as dysmenorrhea. It should be noted here that there are two types of period pain, the primary and secondary dysmenorrhea. What most of us experience is the primary one. The secondary one usually has an underlying medical condition attached to it and only stops completely when you have treated that medical condition. This may range from endometriosis to uterine fibroids, ovarian cyst, cervical polyps, pelvic inflammatory disease, IUD, cervical stenosis, pelvic abnormalities, and uterine abnormalities. These abnormalities have been seen to cause irregular and heavy periods, what's being referred to as menorrhagia. So if you have an unbearable period pain that have refused to go away despite all medical therapies and medications, then I think it's time to visit your doctor for further assessment in case you have any of the other medical conditions that cause this secondary dysmenorrhea. There are lots of pathophysiology and postulations as to why primary dysmenorrhea occurs, but I will not bore you with that because I know what most of us are interested in are solutions to this, our age-long issue. So I'll be sharing with you my top 7 personal and researched methods. Trust me, I am yet to see one method that works for everybody. So don't give up if one method doesn't work for you. Try the next. Exercising. For all the fitness buffs out there like me, this is the best way to go. This does not only reduce the pain significantly, but also keeps you healthy and in shape. To be effective, you have to be consistent and incorporate aerobics workout, and this is done at least 3 times a week for at least 30 minutes. This is my go-to method and it works for me. Cutting down on sugar. This ranges from fizzy drinks to cakes, pastries, ice cream, chocolate, and sweets. Menstruation is an inflammatory process with increased production of prostaglandin at its core, which is responsible for the pain we feel. So taking any fluid or food that has a tendency to increase your prostaglandin production will only intensify your pain. Hot compression pads and bottles. This is done by applying a hot water bottle or other forms of heating pad on your lower abdomen or on the site of the pain. Heat has been shown to relax your uterine muscles and increase blood flow. Ensure to test the bottles and pads at the back of your hand before applying it on your abdomen to avoid first-degree burns on the application site. Adequate rest. Stress and emotional trauma have been shown to worsen period pain. Well, one of the reasons why I neither joke with my heart nor my sleep. Please ensure you have adequate 6 to 8 hours of sleep, especially during your periods. Sexual activities. Ooh. The feel-good dopamine effect, as explained in my previous episode, masturbation, the good, bad, and ugly, together with the endorphins that are released during sexual intercourse, have been shown to significantly reduce dysmenorrhea. Looking at it critically though, you may just have blood all over the room, making it look like a shrine. Some couples can actually find it gross, and it may be considered as a sin according to the Bible. Medications. I hate drugs, but for those of you who don't mind, paracetamol or acetaminophen can be used for mild pain, while non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, and naproxen can be used for moderate pain. The use of medications work best if you're familiar with your cycle, so you take them a day before the pain starts and take them for about 2 to 3 days as prescribed, depending on how long your pain usually lasts for. NSAIDs should be avoided if you have peptic ulcer disease or gastritis, or if you suffer from severe adverse effects. Contraceptives. Combined oral contraceptive pills and progesterone only pills, injections, implants, and IUDs have been shown to inhibit ovulation, which precedes period. So no period pain. Sweet. This is recommended for those who desire an added advantage of pregnancy prevention. However, as explained in my previous episode on contraceptives, the side effects and contraindications should be put into consideration. So do well to discuss with your healthcare provider before commencing any one of these methods. Please let me know if you'll be trying any one of these, and if you already have a method that works for you that wasn't discussed, please do well to share with us in the comment section below. Help a sister out. I hope to see you next week Friday on another exciting episode. Embrace your flaws and stay healthy and pain-free. Mwah.